Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is 10 practice NCLEX questions. Without delay, let's get started.
Which of the following should the nurse expect to include as a priority in the plan of care for a client with delirium based on the nurse's understanding about the disturbances in orientation associated with this disorder? 1. Identifying self and making sure that the nurse has the client's attention. 2. Eliminating the client's napping in the daytime as much as possible. 3. Engaging the client in reminiscing with relatives or visitors. 4. Avoiding arguing with a suspicious client about his perceptions of reality. The correct answer is 1. Identifying oneself and making sure that the nurse has the client's attention addresses the difficulties with focusing, orientation, and maintaining attention. Eliminating daytime napping is unrealistic until the cause of delirium is determined and the client's ability to focus and maintain attention improves. Engaging the client in reminiscing and avoiding arguing are also unrealistic at this time. Which of the following is essential when caring for a client who is experiencing delirium? 1. Controlling behavioral symptoms with low-dose psychotropics. 2. Identifying the underlying cause of condition or illness. 3. Manipulating the environment to increase orientation. 4. Decreasing or discontinuing all previously prescribed medications. The correct answer is 2. The most critical aspect when caring for the client with delirium is to institute measures to correct the underlying cause of condition or illness. Controlling behavioral symptoms with low-dose psychotropics, manipulating the environment, and decreasing or discontinuing all medications may be dangerous to the client's health. When caring for the client diagnosed with delirium, which condition is the most important for the nurse to investigate? 1. Cancer of any kind. 2. Impaired hearing. 3. Prescription drug intoxication. 4. Heart failure. The correct answer is 3. Polypharmacy is much more common in the elderly. Drug interactions increase the incidence of intoxication from prescribed medications, especially with combinations of analgesics, digoxin, diuretics, and anticholinergics. With drug intoxication, the onset of the delirium typically is quick, although cancer, impaired hearing, and heart failure could lead to delirium in the elderly. The onset would be more gradual. The nurse observes a client in a group who is reminiscing about his past. Which effect should the nurse expect reminiscing to have on the client's functioning in the hospital? 1. Increase the client's confusion and disorientation. 2. Cause the client to become sad. 3. Decrease the client's feelings of isolation and loneliness. 4. Keep the client from participating in therapeutic activities. The correct answer is 3. Reminiscing can help reduce depression in an elderly client and lessens feelings of isolation and loneliness. Reminiscing encourages a focus on positive memories and accomplishments, as well as shared memories with other clients. An increase in confusion and disorientation is most likely the result of other cognitive and situational factors, such as loss of short-term memory, not reminiscing. The client will not likely become sad because reminiscing helps the client connect with positive memories. Keeping the client from participating in therapeutic activities is less likely with reminiscing. The son of an elderly client who has cognitive impairments approaches a nurse and says, "I'm so upset. The primary healthcare provider says I have 4 days to decide on where my dad is going to live." The nurse responds to the son's concerns, gives him a list of types of living arrangements, and discusses the needs, abilities, and limitations of the client. The nurse should intervene further if the son makes which comment? 1. "Boy, I have a lot to think about before I see the social worker tomorrow." 2. "I think I can handle most of Dad's needs with the help of some home health care." 3. "I'm so afraid of making the wrong decision, but I can move him later if I need to. For I want the social worker to make this decision so Dad won't blame me." The correct answer is 4. Expecting the social worker to make the decision indicates that the son is avoiding participating in decisions about his father. The other responses convey that the son understands the importance of a careful decision, the availability of resources, and the ability to make new plans if needed. Before we move on to the next question, The NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. An elderly woman experiences short-term memory problems and occasional disorientation a few weeks after her husband's death. She also is not sleeping, has urinary frequency and burning, and sees rats in the kitchen. The home care nurse calls the woman's primary health care provider to discuss the client's situation and background, assess, and give recommendations. The nurse concludes that the woman, 1. is experiencing the onset of Alzheimer's disease. 2. is having trouble adjusting to living alone without her husband. 3. is having delayed grieving related to her Alzheimer's disease. 4. is experiencing delirium and a urinary tract infection. The correct answer is 4. Delirium is commonly due to a medical condition, such as a UTI in the elderly. Delirium often involves memory problems, disorientation, and hallucinations. It develops rather quickly. There is not enough data to suggest Alzheimer's disease, especially given the quick onset of symptoms. Delayed grieving and adjusting to being alone are unlikely to cause hallucinations. The most common reason given by mentally ill clients for noncompliance with medications is their uncomfortable adverse effects. When teaching the families, what needs should the nurse identify as the greatest? 1. Alternative ways to manage the adverse effects. 2. Home visits to set up a week's supply of medications. 3. Family monitoring of the administration of medication. 4. Outpatient monitoring of medication compliance. The correct answer is 1. Ways to decrease or manage adverse effects without additional medications is crucial. Although home visits, family monitoring, and outpatient monitoring may help, if the adverse effects are not controlled, the client is less likely to take the drug, which would interfere with its effectiveness. Before placing the fetal monitoring device on a prima gravida client's fundus, the nurse performs Leopold's maneuvers. When performing the third maneuver, the nurse explains that this maneuver is done for which of the following reasons. 1. To determine whether the fetal presenting part is engaged. 2. To locate the fetal cephalic prominence. 3. To distinguish between a breech and a cephalic presentation. 4. To locate the position of the fetal arms and legs. The correct answer is 1. Leopold maneuvers are performed to determine the presentation and position of the fetus. The third maneuver determines whether the fetal presenting part is engaged in the maternal pelvis. The first maneuver distinguishes between a breech and a cephalic presentation through palpation of the top of the fundus. The second maneuver locates the fetal back, arms, and legs. The fetal heart rate monitoring device should be placed near the fetal skull and back for optimal fetal heart rate monitoring. The fourth maneuver is done to locate the fetal cephalic prominence if the fetus is in a cephalic position. Assessment of a prima gravida client reveals cervical dilation at 8 centimeters and complete effacement. The client has severe back pain during this phase of labor. The nurse explains that the client's severe back pain is most likely caused by the fetal occiput being in a position that is identified as which of the following? 1. Breech. 2. Transverse. 3. Posterior. 4. Anterior. The correct answer is 3. When a client has severe back pain during labor, the fetus is most likely in an occipito-posterior position. This means that the fetal head presses against the client's sacrum, causing marked discomfort during contractions. These sensations may be so intense that the client requests medication for relief of the back pain rather than contractions. Breech presentation and transverse lie are usually known prior to 8 centimeters dilation, and a cesarean section is performed. Fetal occiput anterior position does not increase the pain felt during labor. The primary health care provider prescribes scalp stimulation of the fetal head for a prima gravida client in active labor. When explaining to the client about this procedure, which of the following would the nurse include as a purpose? 1. Assessment of the fetal hematocrit level. 2. Increase in the strength of the contractions. 3. Increase in the fetal heart rate and variability. 4. Assessment of fetal position. The correct answer is 3. Fetal scalp stimulation is commonly prescribed when there is decreased fetal heart rate variability. Pressure is applied with the fingers to the fetal scalp through the dilated cervix. This should cause a tactile response in the fetus and increase the fetal heart rate and variability. However, if the fetus is in distress and becoming acidotic, fetal heart rate acceleration will not occur. The fetal hematocrit level can be measured by fetal blood sampling. Scalp stimulation does not increase the strength of the contractions. However, it can increase fetal heart rate and variability. Fetal position is assessed by identifying skull landmarks during a vaginal examination. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.